Evaluation in social marketing is always a problem because the cost of evaluating a program can sometimes exceed the cost of creating the program, particularly one like Loving Support, where we're relying on a lot of in-kind support from state health departments and with personnel. We were unable to get a large budget for a national evaluation, unfortunately. We have monitored the Ross six-month infant survey, mother survey data, and in the states that have implemented Loving Support, we have seen the behavioral needle move. We've been heartened by that. What you really need, of course, is an intervention site and a control site and baseline data and then post data. And the only state that has been able to receive funds to be able to do that in that design has been Mississippi. Now, Iowa has come close to that with a mail survey, and they've also done a fine job with implementing the program and evaluating it. The data would suggest that in the case where we do have a sort of quasi-experimental design, that Loving Support has been quite effective. We've not only seen knowledge increase and attitudes increase, but we've actually seen breastfeeding duration as well as incidence increase. And in Mississippi, which had the lowest rates in the country, you would expect the challenge to be the greatest because there's no social support for this. Social norms are lacking. And yet in there we did see a statistically significant difference in the intervention sites while little changed in the control sites. So with that data, the United States Department of Agriculture has now contracted with Best Start Social Marketing to go to other states and help them implement it, like Iowa and Mississippi and California and others have done in our pilot round. And so now most states are starting to get the training and be able to implement it in an integrated way. One of the more exciting things about having worked on this project now since, I think our first social marketing program to promote breastfeeding, we did the research in the late 80s, and then we designed the intervention in the 90s. And we realized that one of the great opportunities that we couldn't afford to miss was to work through the WIC program. And at the time I was the administrator over the WIC program in Lexington, Kentucky. And it was very interesting for me as an anthropologist who had been an administrator for a long time to get back out in the field and listen to women talk. It was a life-changing experience to do these focus groups around the Southeast and listen to women. And to see breastfeeding through their eyes, because I was so interested in promoting it because of the health reasons and because of the savings for the country. And of course, women don't have babies for the health reasons or to save money for the country. They have children, they have close, loving families. And so to see this through their eyes was very wonderful for me. The other part that has changed my career was to realize that the women who looked so uninterested when you sat across the table from them, counseling them in the WIC setting, as I would do, suddenly come alive and be so articulate and bright when they were being listened to, when I paid them $20 for their opinions and listened intently instead of telling them what they should do. These women are so much more intelligent and engaged in their lives than you would ever imagine when you are not letting them be the expert. It says, I think, a lot about how we set up our public health system, where they have to qualify and put their hand out for help, as opposed to our being equal partners with them and realizing all that they have going on in their lives, and then build on those assets instead of look at their deficits. So that was very important in my growth as a public health professional. And it's been fun, too, to see that taking that knowledge and deciding to share it with other people working in WIC, the way we did that is we created a training program, the 3-step counseling program. And it's designed to make a public health professional sort of a mini marketer on the spot, because the steps start with ask open-ended questions that elicit their concerns, and that's exactly what consumer research is instead of starting with preconceptions about what I think will make you want to breastfeed, I listen to what you're interested in. Instead of judging what your costs will be, I listen to what your concerns are. And so right away I'm on your page instead of mine. And then the second step is to acknowledge your feelings, not jump to the education and all about what I want to tell you, but to acknowledge your feelings and concerns and build a dialogue that allows us together to discover the information that will help you overcome that cost and realize your dream. And that's, I think, it really summarizes social marketing. And it also has been wonderful for me to go back to WIC clinics around the country and see how many have adopted this strategy and how much more rewarding their jobs are as a result of it.